Thank you, Senator. Mr. Cruz, you and I had an opportunity to speak a little bit about 105L lease payments and the concern that I expressed that it's this balance. We've got to continue supporting tribal self-determination while we also address the funding pressures that are associated with both contract support costs and 105L. And I don't expect you to, in 1 minute or less, be able to solve the problem, but I do recognize that you have some history and some background in this, in your experience at both Interior and HHS. And so what I would like is your commitment to work with this committee as well as those of us on the Interior Appropriations Committee and our tribal leaders to really figure out how we are addressing the many issues that are in front of us with contract support costs and 105L.
Yeah, absolutely, Chair. I love 105L leases. I think they are have really improved infrastructure in Indian country. They've been a critical tool to our 638 partners. So I do eagerly look forward to you, working with you and your team on this matter. This is a policy area I'm personally invested in, having been there for 105L lease number 1 at the U.S. Department of the Interior. And so it's one of those really powerful authorities that does a lot of good, but can go sideways very quickly if misapplied or mismanaged. So look forward to working with you. And it's also unique because the governing Part 900 regs apply to both the U.S. Department of the Interior and U.S. HHS. And so I've seen it, having been at both. Like, we have different views about different matters on the same reg and the same words on a piece of paper. So it would look forward to that conversation. Well, very exciting.
I think it is an important one, and one that we're sitting here in the authorizing committee now. But again, I mentioned my role on the appropriations side of it, and just having some level of predictability when it comes to budgeting. As you know, these are challenges also that we have to reconcile. So I look forward to ongoing engagement with that. Speaking a little bit about tribal self-governance, we've been expanding self-governance across HHS for a period of time. In my view, some good improvements and developments, but we also know that we've got some barriers to this as well. I am going to be introducing soon, with the support of my vice chair here, the Native Children's Commission Implementation Act, which we're really quite excited about, but we're going to be proposing in that targeted self-governance pilot that is focused on SAMHSA programs. Again, looking to ways that we might be able to provide tribes with greater flexibility. And so I think you have shared it with me privately, but can you share with the committee here your views or your support for the goal of expanding self-governance opportunities across HHS, and hopefully your commitment that you can work with tribes and those of us here on the committee and in Congress to identify some additional areas and ways that we can move these efforts forward.
Yeah. Thank you, Chair. Self-governance really excites me, and strong supporter. So I've been very clear with the advocates when asked, and the Secretary's on the record, both publicly and in congressional testimony, being generally supportive of the concept of self-governance expanding beyond Indian Health Service. The challenge is our authority, and that's going to take a congressional fix. Our OGC has looked at this sideways, up and down, tried to get there and get creative. We just can't. So we're going to have to work together, and I look forward to working with you and your team on that. To do so, just a couple of observations really quick. You have the contract support costs in 105L matters that you always have to be aware of when it comes to 638 land, but also the staffing that goes behind it. It takes human capital and personnel to approve both the contracts, the Title I contracts and the Title V compacts, the review of the audits. There's just a lot of human capacity that is involved. And so right now, all of our optives are not set up that way. So that would take, additional capacity and resources from Congress.
We will definitely look forward to working with you on that. Senator Rounds.
Thank you, Madam Chair. Mr. Cruz, first of all, thanks for the opportunity to meet in our office. I appreciated it. I really thought that you were thoughtful in the way that you responded to a number of the inquiries we made with regard to improving the quality of life in Indian country, and in particular with 9 treaty tribes within South Dakota. We care about trying to improve the quality of health care, the delivery of that on a tribe-by-tribe basis, recognizing their autonomy and their sovereignty, but also recognizing that a lot of the challenges are similar in each one of those rural areas. Mr. Cruz, in your testimony, you mentioned that one of your top priorities is improving purchased and referred care. I agree that significant improvements are needed. That's why we've introduced the S-1055, the Indian Health Service Emergency Claims Parity Act, and S-699, the Purchase and Referred Care Improvement Act. The Indian Health Service Emergency Claims Parity Act would move the PRC's emergency notification requirements from 72 hours to 15 days. The Purchased and Referred Care Improvement Act would require IHS to develop procedures to reimburse beneficiaries for approved PRC services within 30 days and make sure that IHS addresses any unintended costs for beneficiaries with approved PRC claims. I wanted you to talk a little bit about those two, because on the one side right now, if you're telling people you've got to be able to make a notification within 72 hours or you're not going to pay the bill, seems to me to be really unfair to people that are in an emergency situation. I think 15 days is much more appropriate. And the second part on it is these folks have a tough time maintaining a good credit rating anyway, but when it comes right down to it, when they're going to start getting billed for the fact that they can't get a bill paid within 30 days, and it's because it's an obligation that we have at the federal level, and it's not getting taken care of by IHS, that really does hurt some of the poorest of the poor within our country. Can you talk a little bit about how important those reforms are and your thoughts about trying to get those, should we get these passed, that we get that included and operational as soon as possible?
Mm-hmm. Thank you, Senator, and I really enjoyed our conversation. For the record, it was my toughest meeting with the Senate Indian Affairs Committee members, because South Dakota has some of these knotty, thorny issues. And based on our conversation, I went back, talked to a couple of my colleagues at Indian Health Service to understand what that looks like and why we don't already do that. 72 hours seems kind of arbitrary to me. So if confirmed as director, I would continue to look at the Indian Health Service team, understand that, and work with you and your team on this legislation, because at the end of the day, my priority is patient care. And I want to make sure that if a tribal member who happens to have an emergency in Rapid City and end up at the hospital there, while they're up there for the weekend or shopping, that they're not harmed financially or otherwise because they didn't turn in their receipt soon enough for reimbursement. So I want to err and be cognizant of the real life challenges and make sure that the PRC program works for our beneficiaries today and contemporaneous times, and that it ultimately works because we have the resources there, we have the know-how and the knowledge, and so it just makes sense to provide those patients that flexibility.
Well, I look forward to working with you. I think our tribes have made it clear that they think that you will do a good job for them, and I intend to support your nomination. but I really want to get to the bottom of some of these issues that our citizens simply shouldn't have to contend with year after year. And these are some that should be fixed.
Absolutely.
It's only fair. The other item that I just want to just touch on briefly is right now, I think sometimes there's a concept there within Indian Health that suggests they're trying to figure out a way not to pay a bill than to pay a bill. When you start talking about coming from the wrong county within a state, and you're not being treated in the same county that you're being treated in, or you're not supposed to go to a particular facility because it's in a different county than what you live in, therefore they won't touch the billing. I think we all agree that that's foolish. We've tried to fix that in the past, and then we found, once again, this challenge out there. And I think you and I talked about it a little bit in my office, but this is one that I think has to be resolved.
Yeah. So, Senator, thank you for bringing this matter to my attention. I know I flagged it for the IHS team, and happy to provide a written update on where we are with that on the QFRs.
No, look, I appreciate that, and we'll give you that opportunity as well.
Thank you, Senator.
All right, thank you very much. Thank you, Madam Chair.
Thank you, Senator Rounds. I always appreciate the questions that you have and understanding some of the healthcare challenges that you face in your region, because it is very different than what we have experienced in Alaska. And it always hasn't been good in Alaska. Believe me, it's been pretty tough. It was very tough initially. But we are in a different place now. We've got 229 federally recognized tribes in Alaska, and yet through what we've been able to do with self-determination, self-governance, in working through our Alaska Tribal Health Compacts, it's really quite remarkable. And I think that Secretary Kennedy saw that in his visit last summer when he came. Not only are we building infrastructure that meets the need, but we are in a place where our ability to deliver care is probably some of the best example that you will see in Indian country, and some would argue that in rural areas, how we have done it through our compacting is the promise and the model for that. And I'm not suggesting that we can take the Alaska model and replicate it everywhere, but it is a reminder to me of the extraordinary disparity that we have when we think about situations in your state of South Dakota, and what Native people experience, the failures that they experience. It makes me feel proud of what we've been able to do, but it challenges me to make sure that it should not depend on where you live. If you have a system that is designed to, or a system that is there to protect Native people and to provide for their care, that care needs to be good and consistent throughout.
Madam Chair, if I could just respond, and I really appreciate your thought process on this. In South Dakota, we have the 9 treaty tribes. These are tribes that by treaty have established their sovereignty, but they've also established a direct relationship with the government of the United States. And part of that agreement was the issue of health care and responding to the health care needs. Mm-hmm. So our tribes, they have an understanding that this is by treaty right should be provided by our government. And they're frustrated because as a treaty right, I think there's a thought that it should be provided and that we shouldn't have to be fighting for it all the time. Mm-hmm. The challenge that I have, because I don't think it's up to us to tell them how to get that health care provided to them, but we should be working with them in a consultative way to make it deliverable based on what their needs are and the way that they would like to work with the government on it. And so whether it be by compacts, by 638s, or directly through Indian Health, I've shared with them that this is a decision that they need to make, but we will help where we can to try to facilitate that final decision that they do.
Mm-hmm.
And I personally think that IHS needs to be a payer, but not necessarily the direct provider. I think that might be more efficient and provide a higher quality if we went directly to organizations that already exist within our state that whose responsibility is providing health care, whether it be a healthcare network or otherwise. But this is a decision that the individual tribes need to make, and then we need to help them follow through on whatever they think is the right way to provide it for their people.
Mm-hmm.
And I just would look forward to working with you to try to work that in a way that works for them.
Yeah, absolutely. Thank you, Senator.
Thank you. Thank you, Madam Chair.
Thank you, Senator Rounds. Let me ask a couple more quick questions here to you, Mr. Cruz. Sanitation funding. We have made some good inroads as a result of the bipartisan infrastructure bill. We just recently received the FY26 IJA sanitation funding allocation. These were good. They're important. And for those that have waited far too long for sanitation infrastructure, it is most welcome. I am concerned, though, because we know that the infrastructure funds are winding down, and in fairness, these funds were designed to address the unmet needs. It wasn't intended to replace the need for sustained annual investments. So we have to continue to build on this in a way that allows us to operate and maintain these systems long term. So a question to you is how we ensure that we've got solid base funding going forward for operations and maintenance as we move forward on this. When I think about the role of just basic sanitation in meeting healthcare needs of Native people, regardless of where they are, to me this is pretty basic. Clean water to drink, to wash your hands, keep your family clean. It's pretty basic, and it goes to healthcare. So can you speak to that?
Yeah, thank you, Chair. I am on the same page, same wavelength as you when it comes to the importance of sanitation and the importance to health. A couple of thoughts. I understand IHS has gotten the last of that IIJA funding out. There are over 2,000 active projects. I look forward, if confirmed, I look forward to ensuring those come to completion. I also look forward to working with the team on lessons learned and identifying and advocating for robust resources to continue that work. I think a lot of good has been done in this space. Look forward to being partners with you in the committee and the Indian Health Service staff to continue that momentum. The other thing, as I was asking about this when I went back after our conversation, is tribes add their projects to this list. So I always ask, like, why does it seem to grow, or like, how do we not get ahead of it? It's one of those things where things change over time, and people can add projects to this list, and IHS stands at the ready to work with them on it. And it's about identifying the need and us doing our job to come be effective advocates, and then go work with them to get those projects in their communities. So I'm eager to get more involved in this component of the mission of the Indian Health Service.
Well, I appreciate that, and I invite you up to the state anytime. I look forward actually to the day when I have somebody coming out from Washington, D.C. To understand some of our situations and challenges, and I look forward to the time when I have a hard time finding a village that is still lacking running water and clean drinking water. And unfortunately, I've got a whole long list of them. And at the same time that you think about what that means just from a hard life, I bet if you wanted to do a direct correlation to the health of the children in that village that doesn't have the drinking water versus those, and just clean water to wash in, versus those communities that do even have minimal, I think the statistics would speak for themselves. So let me turn to Senator Hoeven. We had a great conversation here this morning with our nominee.
Thank you, Madam Chair. Appreciate it very much. My office received letters of support for Mr. Cruz's nomination to serve as director of IHS from both the Standing Rock Sioux Tribe and the Turtle Mountain Band of Chippewa Indians, and I would ask the chairman for unanimous consent to enter these letters of support into the record.
Absolutely.
And Mr. Cruz, thanks for coming to visit with me. Appreciate it. One of the big challenges is modernizing IHS. Mm-hmm. All healthcare is going through the same technological revolution that everybody else is, maybe even more so in some ways with AI and everything else. What are your thoughts on how you're going to, but IHS needs to modernize.
Yeah.
What are your thoughts on how you're going to do that?
Thank you, Senator. I think first and foremost is my vision and goal is when you walk into an Indian Health Service hospital or clinic, you can't tell the difference between a county or other private provider. And we see that in our 638 space. We just see some of the most magnificent facilities. Travel to Oklahoma, river people in Arizona. The secretary and I have gotten out into Indian country to see some of these just amazing investments into tribal communities. And so what I'd like to do is, take those lessons learned from our 638 partners and see what we can do on the direct service side. The other issue that I'm aware of that we're going to need to spend some thinking time on and planning on is the electronic health records. That's a significant investment. And I think that's probably one of the system's biggest deficiencies right now, especially when you compare it to private or other models, is we really want to make sure that IHS's patients are not impacted by having this antiquated legacy system. So that's something I'm eagerly looking forward to learning more about, engaging with the Indian Health Service team and coming up with solutions to bring Indian Health Service into the next generation and provide modern, clean, and safe health options.
You say you've been out some with the Secretary. You mean Secretary Burgum? Is that who you're referring to?
Secretary Kennedy, sir.
Secretary Kennedy.
Yeah.
Well, that's good. And I like you mentioning the 638. I think that creates real opportunities. That was actually, I was going to be my next question, but you went there. I think that gives you flexibility to work and empower tribes as much as you can. And they're at different levels in different places. Mm-hmm. And so that flexibility is important. The other thing that's really important is that you've got a lot of people in medical professionals that actually want to volunteer time. Mm. And the credentialing process prevents them from doing it. So you've got not only doctors, but dentists and other medical technicians and folks who would like to go out to the reservation and volunteer some time, but they have problems getting credentialed through the IHS process. What can you do about that? And I brought this up before at this committee, and it's still a barrier.
Yeah, absolutely. Look, we want to take advantage of all the opportunities that come forward. And so I kind of alluded to this in my testimony. My goal is to hire smarter people than myself. One such person is Dr. Hartwig, who's a political appointee at Indian Health Service. And so I'd rely on her expertise around how you do some of these partnerships, what goes into the state licensing and credentialing. Because we are in 37 different states, sometimes that gets a little tricky. And so I would really have to work with the Indian Health Service career professionals and rely on their advice and their experience on how we do take advantage of people who do want to come in good faith and help ensure that American Indian and Alaska Native patients have quality health options, even if it is on that temporary basis.
You need to, because I think you're missing, highly skilled help that's available if you don't. Define success. So if whatever point you finish in this job, you look at it and say, okay, you succeeded. What is that? Define that.
Yeah. Thank you, Senator. I think putting that 93 construction list on a glide path to completion is just one of the passion projects of mine. I think also the EHR is a critical component, making sure that we have a game plan. We're not going to solve it overnight. It's going to take tribal consultation, engagement with all of our partners, tribal and urban, to ensure that we're providing a plan that is implementable and realistic. So those two come to mind. And then 3 is building a strong team around me and providing that stable leadership. And then I think finally my last line of thinking is I want to, every step in my life, I've tried to leave someplace better than what I found it. That's a traditional teaching of ours, and I look at this opportunity being the same. I want to leave IHS better than I found it.
Yeah, I think you mentioned building that team. If you walk out and you've strengthened that team and they're doing a better job, that's something that outlasts you and is a great legacy. So again,
absolutely.
Thank you for stepping up, and we look forward to working with you.
Thank you, Senator.
Thank you, Senator Hoeven. And Mr. Cruz, I'm glad you raised the issue of electronic health records and the modernization effort. Big challenge, but has to be done.
Yeah.
But just in terms of investments, it's my understanding you're looking at almost a $1 billion price tag here. But it's not just the cost. You've got timelines that are involved in it, but also how this transition is going to impact those self-governance tribes that have already invested in their own systems.
Mm-hmm.
So how you reconcile that?
Yeah.
Good luck to you, sir. I mean,
yeah.
it's going to be a challenge, and I mean we see this in other departments and other agencies. Most notably within the VA and the DoD. They've been saying for years that they're really going to align their systems, but in fairness, DoD is waiting for VA to align with them, and vice versa.
Mm-hmm.
And so you have kind of a square off that's just been hard. I mean, they're getting there, and I shouldn't compound their problems by being critical about it, but it is an observation that it is not as easy as just writing or getting the funding authorization for it. There's a great deal of effort that will be required, but it is something that is required. So mm-hmm. a big part of your challenge there. Well, I think you've gotten a wide range of questions this morning from members of the committee.
Mm-hmm.
We will keep the hearing record open for the next 24 hours, but we would like to get these submitted by the end of business tomorrow, so that we can do what the committee needs to do next, which is hopefully move you to a markup. So I appreciate the honest and direct responses that you have given to folks, and with regards to any questions for the record that will follow, that we would expect a level of the same. But we thank you for being here. We thank your friends and supporters for being here to support you, and for your willingness to step up and serve. And with that, the committee stands adjourned.